carbo until today we have seen carbohydrates, metabolism of carbohydrates, utilization of glucose in the body. Okay, we have seen this part, how there is a regulation of blood sugar level with the combined action of your glucagon and insulin. We have seen that. We have also seen different hormones, effect of different hormones on the glucose level of your body. We have seen, so hyperglycemic hormone, hypoglycemic hormone. We have seen about the types of diabetes mellitus. Okay, we have seen the insulin, discovery of insulin and etc. Bendingen based 1921. You have to remember. Okay, so we have seen the effect of insulin. We have seen the pancreas has different cells and the different cell will produce different hormones. That part is important again. Glucose is the most potent stimulus to the release of glucose. जैसे ही आपके बॉडी में ब्लड में ग्लूकोज लेवल बढ़ जाएगा तो क्या होगा, वो बढ़ा हुआ ग्लूकोज लेवल ब्लड में वो ब्लड आपको पैंक्रियाटिक आर्टरी में भी जाएगा. So pancreatic artery will also have higher blood glucose level. So that glucose will enter into the beta cells of Langerhans. Whenever the glucose molecule will enter into beta cells of Langerhans, so that is oxidized to ATP. Now ATP increase the ATP production in the beta cells of Langerhans. So there is a one pump known as a ATP sensitive potassium pump. अगर ATP बढ़ गया beta cells में तो ATP sensitive potassium pump क्या होगा, inhibit होगा. Okay, so what is the function of that pump? To remove the potassium outside. Now if it is inhibited because of the increased ATP by the glucose, okay, glucose itself, so there is a increased positive potential in the cell that leads to activation of calcium channel. Calcium channel will be activated, calcium will enter in the cell and that will bring about the exocytosis of insulin from the insulin granules. Okay, so that is the normal process how insulin is released upon the entry of glucose. So glucose will enter into the cell by GULT2, glucose transporter 2, and inhibit the ATP sensitive channel responsible for the this is responsible for the depolarization and which result in the insulin release. We have seen this. We have seen the insulin receptor, how insulin will bind to the receptor and how it will stimulate the release of insulin, how it will increase the utilization of glucose. Okay, we have also seen these insulin mixtures, rapid acting, fast acting, etc., etc. We have seen that part also. Now we'll start from this part today. There are different kind of insulin preparations, as I told you: rapid acting, slow acting, intermediate acting, and fast acting. Or rapid acting means fast acting, intermediate acting, then long acting preparations. So conventional insulin preparation or injections, they are given by subcutaneous route or intravenous route. But nowadays, as there are advances in the therapy, as there are more research, so insulin pumps has been developed. Even insulin pumps are there. Okay? So insulin pumps and even nowadays smart insulin devices are there. You can see in this diagram. So this is a insulin pump. So which is a smart insulin pump. In this, suppose if anybody is doing job, if anybody is engaged in the job, and doctor prescribe him a insulin injection 3 or 4 times a day. So that it is not easy to manage all the work and to take the insulin injection 4 times. So he has to carry the syringe, he has to carry the vial and all that. So instead of carrying all these things, just a small device which is controlled by even your phone also, or it is a already programmed. Okay, it can be already programmed, but nowadays it can be controlled using your phone. So in the phone, you just have to set your timing. Suppose 12 a.m., 12 p.m., then 3 p.m., then 6 p.m. So if you want to take a 3 times the injection, just set a timing 12, 3 and 6 and set a amount of insulin to be injected. Suppose 1 unit, 2 unit or 5 unit. So depending on that, on the time it will automatically inject insulin in your body. So like this also. See, this is little bit older pump. So like your old mobile. So it is a pre-programmed pump. So there is no need to take insulin repeatedly. So pump will do its work effectively. So you know that there are two types of diabetes. Type 1 diabetes is known as a is known as juvenile onset diabetes, and also known as insulin dependent diabetes mellitus. Okay, juvenile onset means that occurs in the early ages. Juvenile onset means that diabetes can occur in the early ages. बचपन में भी हो सकता है आपको और आपके जब आप बालिक मतलब बालक एज में हो उस टाइम पे भी हो सकता है. दैट्स व्हाई इट इज नोन एज जुवेनाइल ऑनसेट डायबिटीज. ओके, सो डायबिटीज दो टाइप का होता है. फर्स्ट वन इज नथिंग बट द इंसुलिन डिपेंडेंट डायबिटीज और जुवेनाइल ऑनसेट डायबिटीज. टाइप 2 is nothing but the non-insulin dependent diabetes mellitus or it is also known as maturity onset diabetes. देखो टाइप 1 जुवेनाइल होता है, टाइप 2 होता है मैच्योरिटी onset. You have to remember. So if there is a okay, now type 1 diabetes mellitus is because of the destruction of pancreatic beta cell due to autoimmune disease. So there is a destruction of pancreatic beta cells, so there is an absolute lack of insulin. वहाँ पे इंसुलिन होता ही नहीं. That's why the patient has to take insulin for the utilization of glucose for lifetime. Okay. Now in type 2 diabetes mellitus, so there is a insulin, there is a decreased level of insulin or there is a less insulin, but there is a insulin or there is a insulin in the type 2 diabetes mellitus. Either there is a less insulin production or there is a insulin is a enough. Okay, but its activity is decreased. That means cells or tissue will develop a resistance to the available insulin. Okay? In the type 2 diabetes mellitus, type 2 diabetes mellitus is results in the due to different conditions. For example, obesity is one of the reason where it can happen in a non-obese person also. Then maturity onset diabetes mellitus, it is known as a maturity onset diabetes. This one is a juvenile. Okay, now if there is a lack of insulin का अगर deficiency है, so if there is a lack of insulin, what will happen? Lack of adequate glucose metabolism. So there will be no metabolism of glucose. Insulin is not there. So metabolism of glucose will provide the energy, but as there is a no metabolism, so no energy, so to provide, okay, no energy, and as there is a no energy in the body, so body will try to get energy from something else. And what is that something else? There is a lipid. So body will try to break down that lipid, lipolysis will be there. So that will increase the acetyl CoA concentration in the body and free fatty acid in the body. Okay, so increase the lipids in the body. Okay, and that acetyl CoA, which is produced by oxidation of lipids, that will enter into Krebs cycle that leads to catabolism. Finally, again synthesis of energy. That's why there is a increased ketone bodies in the diabetic patient. Increased ketone body, ketone bodies increase होगा. Increased lipid level in the diabetic patient. Okay, increased lipid level in the diabetic patient. लॉन्ग स्टैंडिंग डायबिटीज मेल्टस. इफ डायबिटीज नॉट ट्रीटेड, डायबिटीज का ट्रीटमेंट नहीं हुआ, बहुत देर से बहुत समय से आपको डायबिटीज है, लॉन्ग स्टैंडिंग डायबिटीज मेल्टस और improperly treated diabetes mellitus in that patient. So improperly treated diabetes in the patients, what it leads to the glycation of protein. Glycation मतलब addition of glucose to the protein. कौन से protein? The protein present in your blood. So there are albumin, globulin, hemoglobin, okay, then collagen. So these kind of proteins are present in your blood. So if there is untreated diabetes mellitus, if there is a long-standing diabetes mellitus, what will happen? As long-standing diabetes mellitus means long time, there is increased the blood sugar level for longer time. So that increase the sugar level, what will it do? That sugar will be added to the protein. So addition of sugar to the protein, sugar addition to the protein, or sugar plus protein is known as a glycation. Glycation is addition of glucose to the protein. Okay, so okay, that leads to glycated protein. So change in the glycated proteins. तो जो नॉर्मल प्रोटीन होता है तो वो तो बॉडी में होता है, वो बॉडी इसको एक्सेप्ट करती है. But glycated protein means there is a additional something in the protein, so that may act as an antigen. So it is so that protein is converted into advanced glycated end product. It is advanced glycated end product of protein. Now this protein binds with the receptor. So if it is a normal protein, there is no problem, it will do its function. But nowadays, now what happens? It is a glycated protein, so it acts as an antigen. So because of that, there is a release of cytokinins and initiation of coagulation, and that result in the formation of white thrombus, and that leads to arteriosclerosis. So diabetes is the one of the important cause for arteriosclerosis. Arteriosclerosis मतलब क्या है? जो blood vessels है आपके, okay, blood vessels, उसमें deposition हो जाएगा. There is a deposition of plaques. Okay? There is deposition of plaques, or there is deposition of thrombus or lipids. There is a narrowing of blood vessel. The part which is जो दूसरा पार्ट है, जैसे यहाँ पे कोई ऑर्गन है, मान लीजिए हार्ट है आपका, सो द ब्लड वेसल which is supplying a blood to a heart, if there is arteriosclerosis in that blood vessel, say for example coronary artery, so what will happen? You may suffer from myocardial infarction, or you may suffer from angina pectoris, you may suffer from congestive cardiac failure. So arteriosclerosis is also because of the diabetes. Now glycation means addition of glucose to the protein. Glycosylation means addition of other sugar, okay, other sugar to the protein like fructose and all that. Okay, advanced glycated. सिग्निफिकेंस ऑफ ग्लाइकेटेड हीमोग्लोबिन, इसके ऊपर एक क्वेश्चन आ चुका है, इसलिए ये पार्ट ऐड किया है मैंने. सो व्हाट इज द नॉर्मल, ओके, so in the what is the normal value of HB1AC means glycated hemoglobin, so that is nothing but the 6.5%, 6.5 gram percent. इसके बारे में एक बार क्वेश्चन आ चुका है. So glycated hemoglobin means addition of glucose to the hemoglobin. So if glycated hemoglobin is more than 6.5 gram, that means you are suffering from diabetes. Glycated hemoglobin, remember HB1AC question आ चुका है इसका. Now we'll see sequence of event, what happens. So how insulin will act, I'm repeating this because it is important. Insulin का receptor, we have seen insulin receptor, so it has a two subunit, two alpha subunit, two beta subunit. Alpha subunit, they are located on the plasma membrane. Beta subunit, they are located on the intramembrane and inside the cell. Okay, so insulin will bind to alpha subunit, so it will activate the beta subunit, and beta subunit are linked with the tyrosine kinase activity. So activity of tyrosine kinase in the beta subunit, that leads to phosphorylation of certain proteins. Okay, phosphorylation of compound within the B unit. So post receptor binding event that occurs phosphorylation, dephosphorylation, generation of secondary metabolite like IP3. Okay, and they causes the again phosphorylation, dephosphorylation in the cytosolic enzyme responsible for the, okay, and then there is a biological effect of insulin enzyme. There is activation or deactivation of certain enzymes required for the glycolysis, Krebs cycle and gluconeogenesis. So enzymes required for the catabolic reaction, they will be activated. Enzymes required for the anabolic reaction, they will be deactivated. Anabolic reaction के लिए कौन से enzyme लेंगे? For example, synthesis of glycogen, synthesis of glycogen from glucose, that is the anabolic reaction. Okay, now catabolic reaction means oxidation of glucose by Krebs cycle or uh, by glycolysis, that is catabolic reaction. So catabolic reaction के लिए जो एंजाइम लगते हैं वो बढ़ जाएंगे, एक्टिवेट हो जाएंगे. एनाबॉलिक के लिए जो लगते हैं वो कम हो जाएंगे. दैट इज द एक्शन ऑफ इंसुलिन. ओके, अगेन insulin also will stimulate the production of certain transport protein, glucose transport protein, and that glucose transport proteins, they will mobilize glucose from extracellular part to the intercellular part for the oxidation. So internalization of glucose, again that is nothing but the entry of glucose in the cell. We have already discussed this. Now oral anti-diabetic drug, oral hypoglycemic drug. Okay, oral hypoglycemic drug. So instead of this taking this classification first, I will take this classification. तो ये पहले देखते हैं, पहले बाद में वो देखेंगे. Now anti-hyperglycemic drug, they are known as a, also known as a oral hypoglycemic drug. Okay, anti-hyperglycemic मतलब hypoglycemic. Okay, so oral hypoglycemic drugs, OHA, they are known as OHA, capital O in a short form, OHA, hypoglycemic drug or agents, oral hypoglycemic agent, OHA. Now what do you mean by oral hypoglycemic agents? So these drugs are, they are given by orally, not parenterally. Okay, hypoglycemic drug और anti-diabetic drug, they are classified into two classes. दो classes में classify होता है. So first one is nothing but the drug which are given by parenteral route, which are given by injectable route, and second class होता है drug which are given by oral route. Anti-diabetic drugs, they are classified majorly into two types, parenteral drugs and oral drugs, right? Now parenteral drugs, in that you will have different kind of drugs, like first one is insulin. First parenteral drug is insulin. We have seen about the insulin already, so I'm not going to discuss. So insulin, it is a, then second drugs given by parenteral route known as a GLP analogs. GLP analogs, what is meant by GLP? GLP is nothing but the glucagon like peptide. GLP is nothing but the glucagon like peptide. Glucagon like. Now why it is not, it is a glucagon like peptide? When you take a glucose orally, so oral glucose will stimulate the insulin release more than intravenous glucose. अगर आपने ग्लूकोज ओरली खा लिया या फिर ग्लूकोज आप इंट्रावेनस ले लिए तो ज़्यादा इंसुलिन सिक्रेट कौन करता है? सो ओरल glucose intake will secrete more insulin as compared to the glucose taken by intravenous route. Why? There is a reason. So जब आप orally glucose लेते हो, so in your intestine, in response to that presence of glucose, there is a release of one peptide. So upon the oral glucose, there is in response to the oral glucose, there is a also release of one peptide known as a glucagon-like peptide. Now, what is the role of this glucagon-like peptide? GLP. This glucagon-like peptide will increase or will enhance or will amplify the functions of insulin itself. So that's why insulin secretion is increased by more increased by oral sugar rather than intravenous sugar. So what will this GLP do? It will amplify, it will enhance more secretion of insulin. So that's why GLP analog means related drugs, उसके जैसे drug. So exenatide, liraglutide. These are the two drugs known as GLP agonist. Remember question इसके ऊपर this year आ चुका है GPAT 2023. There was a question on this. GLP analog exenatide and liraglutide. So these glutide, okay, tide याद रखो, glutide and natide. So liraglutide and exenatide क्या क्वेश्चन था? Exenatide belongs to following category of oral anti-diabetic agents. ऐसा ही क्वेश्चन था and answer was a GLP analog. Okay? So GLP analogs means glucagon like peptide analog, exenatide and liraglutide. Okay? Then next parenteral drug is nothing but the amylin analog. So amylin analog मतलब क्या है? So it is known as a islets of Langerhans. Islets amyloid एक प्रोटीन होता है. It is also protein. So islets amyloid insulin protein. Okay? Islets amyloid insulinogog protein. So ये भी ये होता है protein. Okay? So that is also one protein. So it's analog. So pramlintide. Okay? Pramlintide. So this protein will decrease the absorption of glucose from the intestine. So that's why it is also used in the diabetes. So amylin analog, pramlintide. And remember, this is only drug which is approved for type 1 as well as type 2 diabetes. Pramlintide is the only drug which is approved for type 1 as well as type 2 diabetes. Okay, only drug after insulin. इंसुलिन तो पहला है. इंसुलिन तो इमरजेंसी ट्रीटमेंट के लिए टाइप 2 में ही यूज करते हैं. टाइप 1 तो इंसुलिन के बगैर नहीं जी सकते. So after insulin, only drug which is approved for type 1 as well as type 2 diabetes, that is a pramlintide. Okay. Now this was the injectable drug or this was the parenteral drug. Okay. Insulin, GLP analog insulin, then GLP analog like exenatide, liraglutide, and then amylin analogs. Okay. Pramlintide. Now next one is a oral hypoglycemic drugs. Oral hypoglycemic. They are also classified into different two categories. First, those drugs which stimulate the insulin release from the pancreatic cells, pancreatic Langerhans. They are also known as insulinogog or they are also known as secretagogue. इनको बोलते हैं इंसुलिन सिक्रेशन एनहांसर, इंसुलिन सिक्रेशन इंक्रीजर. इंसुलिन सिक्रेशन ये क्या करेंगे, इंसुलिन का सिक्रेशन इंक्रीज करेंगे. दे आर नोन एज insulinogog or secretagogue. Okay, they release the insulin. So in that you have two classes. इसमें भी दो है, sulfonyl urease and second one is a meglitinides. Sulfonyl urease and meglitinides. So in the oral anti-diabetic drug, remember you have two categories. First category is those drug which releases the insulin. They are known as insulinogog or insulin enhancer, insulin secretion enhancer or secretagogue. And in that also you have two subtypes, sulfonyl urease and meglitinides. In the meglitinides you have repaglinide and nataglinide. Glinides याद रखो, glinides are nothing but the meglitinides. Repaglinide and nataglinide. So these are known as amyglinides, nataglinide and rapaglinide. Question आता है. Then in the sulfonylureas, so first time sulfonylureas was used for the treatment of oral treatment of diabetes. So सबसे पहले orally sulfonylureas आया था. So पहले सबसे पहला ड्रग था tolbutamide. So first generation drug was a tolbutamide, chloropropamide, tolbutamide. So soon after the, okay, as I told you, it was a sudden observation. There was a patient who was suffering from typhoid, and to him there was a sulfonamides was drugs indicated. तो टाइफाइड का पेशेंट था, उसमें सल्फोनामाइड ड्रग्स दिए थे टू ट्रीट द टाइफाइड, बट एक ऑब्जर्वेशन हुआ कि उसका ब्लड शुगर लेवल कम हो गया. So there is a one adverse effect of sulfonamides, that is a decrease in the blood sugar level. Sulfonamides are nothing but the antibacterial drug, बट उसका एक एडवर्स इफेक्ट था कि टाइफाइड पेशेंट में जब उनको यूज किया तो उसका ब्लड शुगर लेवल कम कर दिया उसने. सो दैट ऑब्जर्वेशन मेड टू सिंथेसाइज ए न्यू कैटेगरी ऑफ ड्रग नोन एज sulfonylureas. So in that, sulfonylureas is also classified into two generations, first generation and second generation. First generation is known as a chloropropamide and tolbutamide. Tolbutamide and chloropropamide, they are known as the first generation sulfonamides. तो इनका क्या है कि they have adverse effect known as a hypoglycemia. They have more hypoglycemia as compared to other. So they will produce a hypoglycemia, okay, and they are less sensitive to the, their potency is less. ये less potent होता है, मतलब उसका डोज जो है वो ज्यादा लेगा. So chloropropamide and tolbutamide, they are known as the first generation sulfonylureas. They are having hypoglycemia as a most important adverse effect, okay, and they are less potent. Now second generation sulfonylureas, so in that you have glycazide, glimepiride, then glibenclamide, okay, glibenclamide, glycoside and glipizide. So glee, you can remember glee, CT glee. CT क्या है? Chloropropamide and tolbutamide. They are the first generation. ठीक है, क्वेश्चन आता है कौन सा फर्स्ट जनरेशन बोल रहे हैं. So which of the following sulfonylureas belong to first generation or which of the following sulfonylureas belongs to second generation, ऐसे क्वेश्चन आता है क्यों, या फिर उनका एडवांटेजेस आने. सो फर्स्ट जनरेशन CT, chloropropamide and tolbutamide. Okay, so they are the first generation. They have more hypoglycemia as a prominent hypoglycemia as adverse effect, and they are a less potent होते हैं, इनका डोज ज़्यादा लगेगा. So this is tolbutamide 500 milligram से ज़्यादा लगता है. Then second generation glipizide, okay, glycoside and glibenclamide और glyburide भी है. Glipizide, glycoside, glibenclamide and glyburide, all they are nothing but the gly, okay, gly वाले second generation, but they are more potent than first generation. That's why, and they are having less adverse effect, less hypoglycemia as compared to first generation. Okay, so that is the advantage. Okay, these are the two classes, okay, of sulfonylureas. Now we have seen these are known as insulin releasers. Okay, they will increase the insulin level, they will stimulate the beta cells of Langerhans to release the more insulin. That's why they are known as a insulinogogue. इंसुलिनोगॉग होते हैं, ये क्या करेंगे, स्टिमुलेट करेंगे इसको बीटा सेल्स ऑफ लैंगरहंस टू रिलीज द मोर इंसुलिन. ओके, सो दैट्स व्हाई इंसुलिन रिलीजर और इंसुलिन इंसुलिनोगॉग, दे आर नोन एज, ओके. एंड फॉर द इफेक्टिव ट्रीटमेंट ये ड्रग किस में यूज करेंगे. सो दिस ड्रग कैन बी यूज्ड इन द पेशेंट who have at least 30%, we have at least 30% of the pancreas, जिसमें पैंक्रियाटिक सेल्स होना चाहिए minimum 30%. Okay, so at least 30% of pancreatic cells must be alive, then only these drugs are effective. Because ये drug क्या करेंगे, they will stimulate the pancreas more, they will stimulate the pancreas to release the insulin, but pancreas insulin कब release करेगा. Okay, so if pancreas does not have beta cells, so how it can be released insulin. So for the effectiveness of this drug, a person should have at least 30% pancreatic cell, 30% pancreatic beta cells. Okay, remember this. Now we'll see the next class. So this is known as the first class, which drug which secretes the insulin or drug which stimulate the insulin secretion. Okay? Second class in this is nothing but the drugs which act by the other mechanism. Which act by other mechanism. So in that you have first class bigonides, two gonadino group. So bigonides. In that you have metformin, phenformin. They are also known as AMPK inhibitor. ये अपन next slide में AMPK inhibitor. So adenine monophosphate protein kinase inhibitor. So metformin and phenformin. Okay. Then second, thiazolidine diones. ये chemical classification. Thiazolidine diones. So they are also known as a paroxysmal proliferator activated gamma receptor agonist. Okay. So in that you have glitazones, pioglitazone, rosiglitazone, and or दो तीन drug है rosiglitazone, pioglitazone. They are mostly used. Others are not used. Other drug acting by other mechanism. Third उसमें alpha glucosidase inhibitor. Alpha glucosidase inhibitor. So this alpha glucosidase is the enzyme present in the intestinal brush border. So which is responsible for the breakdown of your oligosaccharides polysaccharides into monosaccharide. ये क्या करेगा ब्रेक डाउन करता है जो स्टार्च खाया आपने उसको ग्लूकोज में कन्वर्ट करता है जो बाकी दूसरा स्टार्च या फिर कोई भी पॉलीसेकेराइड खाया उसको ग्लूकोज में कन्वर्ट करने का काम किसका है अल्फा ग्लूकोसिडेज का ये कहाँ पे होता है इंटेस्टाइन में इट इज प्रेजेंट इन द इंटेस्टाइन राइट now inhibition of this alpha glucosidase results in the decreased absorption of sugar and that's why blood sugar level will also decrease. So in that category alpha glucosidase inhibitors you have acarbose drug then miglitol and voglibose. Okay, miglitol voglibose and acarbose एक और आता है voglibose. Okay, वो अपन देखेंगे next class in this is nothing but the fourth class, that is nothing but the dopamine 2 agonist. Dopamine 2 agonist. So यहाँ पे dopamine का क्या संबंध है? So dopamine, okay, in absence of insulin. So okay, so dopamine deficiency is also related with the insulin, decreased insulin level. Dopamine deficiency is also related with the insulin deficiency, okay, or decreased इंसुलिन. तो डोपामाइन अगर कम होगा तो इंसुलिन भी कम होता है. So that's why dopamine 2 agonist. Example is a bromocriptine. इसके ऊपर भी दो तीन बार क्वेश्चन आ चुके हैं बट वो आपको ये bromocriptine you will have this bromocriptine in the Parkinsonism also. So that's why वहाँ पे भी आए हैं. Now again next class in this is a DPP4 inhibitor. DPP4 क्या है? डायपेप्टिडिल पेप्टिडेज इनहिबिटर. DPP4 मतलब डायपेप्टिडिल पेप्टिडेज इनहिबिटर. ये देखो सिंपल है अभी, ठीक है. डायपेप्टिडिल पेप्टिडेज ये क्या है? डायपेप्टिडिल पेप्टिडेज मतलब ये पेप्टिडेज मतलब एक एंजाइम है. ओके, पेप्टिडेज मतलब प्रोटीन को ब्रेक डाउन करने वाला एंजाइम है. तो कौन सा प्रोटीन? इट इज नोन एज अ GLP. इसको ब्रेक डाउन करने वाला है. GLP को मेटाबोलाइज करने वाला कौन है? DPP, dipeptidyl peptidase enzyme, that metabolize the GLP. So GLP is secreted in response to the oral glucose. Oral glucose का जो आप इंटेक करेंगे उसके रिस्पॉन्स में इंसुलिन तो सिक्रेट होगा ही होगा. So along with the insulin, so GLP is also secreted in the intestine. ये कहाँ पे होता है? इंटेस्टाइन में होता है. इंसुलिन तो आपका पैंक्रियाज में सिक्रेट होगा. बट अपॉन द oral glucose is the most potent stimulus for the insulin, no doubt. But along with that, this protein is secreted, known as a GLP, and it is known as a incretin. The proteins are known as a incretins. Okay, incretins. Okay. Now this protein has a very short half-life, 1 to 3 minutes. 1 to 3 minutes. So what is the role of this protein? This protein will amplify the release of insulin. This protein will amplify the release of कौन सा? GLP. Now this GLP is released upon the oral glucose, not intravenous. So upon oral glucose, these GLP are released, known as the incretins, and it has a very short half-life, 1 to 3 minutes. Okay, and it is metabolized by this enzyme DPP, okay, dipeptidyl peptidase 4. So this enzyme metabolizes the GLP. So if you increase the half or T half of, ठीक है, आपने अगर इसका लाइफ स्पैन इंक्रीज किया तो क्या होगा? ये और भी इंसुलिन रिलीज करेगा. ओके, so if you increase the GLP level, it will increase more release of insulin. So DPP4 inhibitors are also used in the diabetes. So gliptins, sitagliptin, vildagliptin, saxagliptin, allogliptin, और एक दो gliptin है. Okay, so all the gliptins are DPP4 inhibitors. ठीक है, याद रखो. Now next last category in the oral hypoglycemic drug is nothing but the SGLT2 inhibitor. SGLT2 inhibitor. What is SGLT2? It is known as the S means sodium. Sodium glucose co-transport 2 inhibitor. Sodium glucose co-transport 2 inhibitor. What is the role of SGLT? इसका रोल क्या होता है? So SGLT2 is involved in the reabsorption of glucose from the kidney. ठीक है? So आपने देखा होगा urine formation, glomerular filtration, selective reabsorption, active secretion, है ना? ये तीन प्रोसेस होता है. So your urine formation takes place in the three process: glomerular filtration, then selective reabsorption and active secretion. So everything in the blood is filtered except blood cell and plasma protein. किडनी में नेफ्रॉन्स में क्या होता है कि सब कुछ फिल्टर होता है ब्लड सेल छोड़ के और प्रोटीन छोड़ के. So whatever nutritions, whatever sugars, whatever drugs, okay, they are a filter, okay, drug through whatever sugars, whatever nutritions, whatever vitamins, whatever ions are there, they are filtered in the nephron. But 90% of them they are reabsorbed into the blood circulation because body needs them, right? So during this, so glucose is also excreted in the kidney, but 90% it will be reabsorbed, right? So for the body's need, so that reabsorption is an active process, and that is due to the SGLT2. So sodium glucose co-transporter 2 will cause reabsorption of glucose after the glomerular filtration. So this is the transporter involving the reabsorption of glucose in the kidney. So अगर उसको inhibit करेंगे तो blood का sugar level कम होगा, right? So if inhibit this SGLT2, so there is excretion of more glucose, okay, there is a increase in the glycosuria. So this SGLT2 inhibitor. So okay, याद रखो इसका examples: dapagliflozin, dapagliflozin and canagliflozin, dapagliflozin and canagliflozin. These are the sodium glucose co-transporters 2 inhibitor, dapagliflozin and canagliflozin. क्वेश्चन आता है ये क्लासिफिकेशन के ऊपर, और एक बार मैं यहाँ पे भी एक बार बोलता हूँ, दूसरा क्लासिफिकेशन भी अपन लेंगे, ठीक है? सो हाइपोग्लाइसेमिक ड्रग्स और ओरल एंटीडायबिटिक ड्रग्स or simply hypoglycemic drug or antidiabetic drug are classified into two type. First type is nothing but the parenteral drug, those drugs which are given by injectable route. So in that, first one is the insulin. We have seen about the insulin, right? First one is the insulin. We have seen about the insulin. Then second class in the parenteral hypoglycemic drug is a GLP analog, glucagon like peptide analog. Okay? So in that you have exenatide, liraglutide. Okay? So what is GLP? GLP is nothing but a protein which is a peptide which is secreted from the intestine, okay, from the intestine in response to the oral glucose. आपने orally glucose लिया तो वो ज़्यादा इंसुलिन रिलीज करता है. क्यों ज़्यादा इंसुलिन क्यों रिलीज करता है? Because oral insulin also releases one peptide known as a glucagon like peptide, and that peptide GLP amplifies the release of insulin. वो amplify करता है, increase करता है, बढ़ाता है, ठीक है? So that's why oral glucose increases the insulin. Oral glucose secretes the more insulin as compared to intravenous glucose. Okay? So GLP, okay, it is known as a glucagon like peptide. They acts on a specific receptor known as a incretin. उनका receptor होता है incretin. Incretin receptor होता है. GLP act on a incretin receptor. GLP act on a incretin receptor, and they are nothing but the G protein coupled receptor. वो सब बाद में देख लेंगे. हाँ, एक बैच का तो वो है already, एक बैच का नहीं. So incretins are the G protein coupled receptor, and they will increases the insulin secretion. They will increase the insulin action. Okay, and then it has a very short half life. इसका half life जो होता है very short होता है, 1 to 2 minutes. So this GLP has a 1 to 2 minute half life in the blood. 1 to 2 minutes, and as it has a very short half life, after its half life, it is metabolized by one enzyme known as a dipeptidyl peptide. Parenteral में आता है GLP analog, exenatide and liraglutide, and third one is nothing but the amylin analog. Amylin analog, or example is a pramlintide. So amylin analog means it is a peptide again. Okay, it is known as a islets amyloid insulin peptide, IAIP, islets amyloid insulin peptide. What is the role of this? So it increases the absorption of sugar, sorry, it decreases the absorption of sugar from the intestine. ये intestine से absorption कम करता है. So its analog pramlintide is used. So it is only drug used in the type 1 as well as type 2 diabetes mellitus. Okay, this is nothing but the parenteral. Okay, now oral drugs, oral hypoglycemic drug, they are classified into two. First one is the insulin secretagogue, or those drugs which stimulate the insulin release from the beta cells of pancreas, and second one is nothing but the drugs which acting via other mechanism. उसमें दो चार आते हैं. First will see, so drug which release the insulin. In that also you have two classes, sulfonylureas and meglitinides. Meglitinides में आएगा, meglitinides में आएगा rapaglinide and natiglinide, and sulfonylureas, in that sulfonylureas was the first drug which was tested as a oral hypoglycemic drug. बाद में ये meglitinides वगैरह आया. Sulfonylureas in that first generation, chlorpropamide and tolbutamide, they are having hypoglycemia, pronounced hypoglycemia as an adverse. They are less potent, and that's why second generation sulfonylurea is known as a glipizide, glyclazide, glimepiride, and glyburide. So they are the second generation. They are more potent than first generation, and they have less hypoglycemia as compared to this. लेकिन उनको है other mechanisms, drug acting via other mechanism. So in that you have bigonides. So they are also known as a AMPK agonist, inhibitors, AMPK inhibitor. In that metformin and fenformin, thiazolidinediones. So they are also known as a paroxysmal proliferator activator gamma agonist. Okay, so in that glitazones, pioglitazone, prosiglitazone, trohaglitazone, and और एक दो glitazones है. Remember thiazolidinediones. डायन मतलब क्या है? कीटोन. यहाँ पे ऐसा देखो, कीटोन. जोन मतलब क्या है? कीटोन. ओ एन ई. डायोन्स एंड ओन्स. देखो ऐसा कॉम्बिनेशन बाकी इसमें नहीं है. डायोन्स मीन्स कीटोन. So pioglitazone, rosagglitazone, they are belongs to thiazolidinediones. Okay. Now third category in the is alpha glucosidase inhibitor. इसके एग्जांपल है acarabose, मिग्लिटॉल एंड वोल्गिवोस. ये कम से कम 3 बार क्वेश्चन आ चुका है इसका. acarabose, मिग्लिटॉल एंड वोल्गिवोस. सो acarabose का मैकेनिज्म क्या है? इज अल्फा ग्लूकोसिडेज इनहिबिटर. ऐसा क्वेश्चन भी आ चुका है. वन ऑफ द फॉलोइंग ओरल एंटी डायबिटिक ड्रग इज अल्फा ग्लूकोसिडेज इनहिबिटर. तो क्वेश्चन आता है, इंपॉर्टेंट है, अल्फा ग्लूकोसिडेज इनहिबिटर, acarabose, volgibose, and miglitol. Then T2 receptor agonist. Dopamine 2 receptor agonist is a bromocriptine. Then DPP4 inhibitor, that is a dipeptidyl peptidase inhibitors. ये enzyme क्या करता है? This enzyme is involved in the metabolism of this GLP. So this drug will increase the GLP level, or this drug will increase the half life of GLP. So GLP क्या करेगा? इंसुलिन का secretion बढ़ाएगा. DPP4 inhibitors are the gliptins, sitagliptin, valdagliptin, sexagliptin, and alogliptin. So all these are the gliptins known as a DPP4 inhibitor. And last में आता है आपका sodium glucose co-transporter inhibitor, ये GLT2 inhibitor. So in this, what is the role of SGLT? So it is involved in the reabsorption of glucose from the proximal convoluted tubule. PCT से ये reabsorption करेगा after the glomerular filtration. So dapagliflozin and canagliflozin. These are the drugs used in the diabetes. Okay, so we'll see the classification once again. Okay, you can see we have our oral anti-diabetic drugs. Okay, oral anti-diabetic drugs. Classification दो बार नहीं, 3 बार लूंगा because ये important है. Okay, so first, am I audible you? Okay, first is nothing. Okay, first different books में different classification दिए है. So different books will have different classification, but drugs are the same, little bit different class. Now first class, the drug which enhances the insulin secretion, or the drugs which increases the insulin secretion, or they are also known as insulin secretagogue. ठीक है, इनको insulin secretagogue भी बोलते हैं. Okay, now in that you have two classes. First one is nothing but the KTP channel blockers, or simply, okay, KTP channel blockers or KTP channel blockers. Okay, in that also you have sulfonylureas and meglitinides. Okay, and second class is nothing but the dipeptidyl peptidase inhibitors, DPP4 inhibitors, dipeptidyl peptidase 4 inhibitors. फर्स्ट केडीपी चैनल ब्लॉकर पहले देख लेते हैं. सल्फोनिलयूरेज, टोल्बिटामाइड, ग्लिबिनकिनामाइड, ग्लिपिजाइड, glycoside and glimepiride. Okay. So out of that tolbutamide, okay, tolbutamide and chloropropamide, they are known as the first generation, and then glibenclamide, glipizide, glycoside and glimepiride, they are known as the second generation. Tolbutamide and chloropropamide, तो ये फर्स्ट जनरेशन वाले थे. ये बाकी के ग्ली जो है ना, ग्ली ऑल आर नथिंग बट द सेकंड जनरेशन. तो मैंने बोला है सेकंड जनरेशन फर्स्ट जनरेशन डिफरेंस है. Now second in that you have meglitinides, they are also known as a phenylalanine analog. तो रेपाग्लिनाइड एंड नेटिग्लिनाइड. तो रिमेंबर ग्लिनाइड, यहाँ पे देखो नाइड ना, नाइड और नाइन ऐसा याद रखो कि नाइड क्वेश्चन से मतलब याद रखने की जरूरत भी नहीं है. ठीक है, यहाँ पे क्या है नाइड, मिग्लिटी नाइड, NID एंड इन दैट आल्सो रेपाग्लिनाइड, नेटिग्लिनाइड. बाकी इसमें नाइड किसमें दिख रहा है, नहीं है नाइड. नाइड वाली ड्रग क्या है, मेग्लिटिनाइड्स और फिनाइलालाइन एनालॉग्स. कोई सिंपल है, फिनाइलालाइन एनालॉग्स. Okay, so we have seen this sulfonamide, tolbutamide and chloropropamide, they are first generation. Glibenclamide, glimepiride, glibenclamide, glycoside, glipizide, all these are the second generation. ये gli वाले क्या है, second generation. तो इसमें भी क्या डिफरेंस इतना इजी है, सिंपल है. देखो gli वाले second generation है एंड माइड वाली फर्स्ट जनरेशन है. माइड वाले कौन है, टोल्बिटामाइड एंड एक होता है क्लोरप्रोपामाइड. माइड वाले फर्स्ट जनरेशन सल्फोनिलयूरेज, ग्ली वाले सेकंड जनरेशन सल्फोनिलयूरेज, नाइड वाले मिग्लिटिनाइड्स. सिंपल है, याद रखने की जरूरत नहीं, ऑटोमेटिकली आ जाएगा. बस आपको ये ट्रिक याद रखना. दीज आर द इंसुलिन रिलीजर, केटीपी चैनल ब्लॉकर्स. ये क्या करेंगे, दे विल एग्जैक्टली डू थिंग्स लाइक ग्लूकोज. जैसे बोला है ना मैंने, ग्लूकोज व्हेन glucose will enter into the beta cell of pancreas, it will get oxidized, ATP will be released and ATP sensitive potassium channel will be blocked. Okay, and because of that blocking of ATP sensitive potassium channel, so there is an increased level of potassium inside the cell. Potassium is a positive, so it leads to increased positive potential in cell that stimulate the calcium channel to open. Calcium channel open होता है, calcium will come inside the cell and that causes the depolarization. Also calcium causes the exocytosis of insulin. Now KTP channel blocker means they will block directly KTP channel. They will directly block the KTP channel and prevent the release of potassium from inside cell to the outside cell. That leads to accumulation of potassium inside the cell, which causes the depolarization. Calcium will also come and then exocytosis of insulin. So that's why they are insulin releaser. Now second in that you have dipeptidase inhibitor. Dipeptidase inhibitor. Dipeptidase inhibitor. What is the role of this dipeptidase enzyme? So this is the enzyme responsible for the metabolism. This is the enzyme responsible for the degradation of what? इसका degradation करेगा ये dipeptidase. किसका करेगा? Metabolism. पिछले स्लाइड में बोला था मैंने. Yes, anybody? GLP, right? GLP का metabolism करेगा. So what is the role of GLP? So GLP is nothing but the glucagon-like peptide. Okay, GLP-1. Okay, so it is the glucagon-like peptide which is released when oral glucose is taken. जब आप orally कुछ glucose लेते हो या फिर sugar लेते हो, so in the intestine this GLP is released. What is GLP? Glucagon-like peptide. What will it do? It will amplify. It will increase. It will support. It will help to release the more insulin. Okay. And that's why oral glucose releases more insulin as compared to the intravenous glucose. And GLP is metabolized by this enzyme because half-life of GLP is around 1 to 3 minutes. Okay, so inhibitors of this dipeptidyl peptidase, इसका half-life होता है 1 to 2 minutes. मेटाबोलाइज कौन करता है? डाइपेप्टिडिल पेप्टिडेज. तो इसको डाइपेप्टिडिल पेप्टिडेज को इनहिबिट करेंगे तो क्या होगा? इसका लेवल बढ़ जाएगा. इसका लेवल बढ़ेगा तो क्या होगा? ये इंसुलिन को ज्यादा सिक्रेट करेगा. इंसुलिन सिक्रेट होगा तो क्या होगा? ब्लड ग्लूकोज लेवल कम हो जाएगा. सिंपल. So all the gliptins, sitagliptins, vildagliptins, sexagliptin, allogliptin and linagliptin, ये सब gliptins याद रखो. sitagliptin, सीता मतलब सीता, vildagliptin, sexagliptin, okay, then allogliptin, then linagliptin. तो आपको याद कैसे रखना है ये? एक तो सिंपल है, DPP4 inhibitor मतलब all the gliptins. ठीक है, all the gliptins. gliptin दूसरे इसमें है ही नहीं, उसमें ये सब gliptins. तो एक दूसरा एक ऑप्शन है कि देखो सीता विल्डा एंड लीना, ये 3 लड़कियां है ना, सीता, विल्डा, लीना, ये क्या है, 3 लड़कियां। आलोक लिप्टिन जो ना, इसको आलोक बोलो। सो सीता, लीना, विल्डा आलोक के साथ गए किधर, एक गांव में, इसका नाम है शेगांव। शेगांव में गए, एक गांव में गए, तो ये घूमने के लिए गांव में गए, या फिर कोई भी यस नाम का पार्क ढूंढ लो, यस नाम का मूवी देखना हो देख लो, कोई भी कुछ भी। सीता, विल्डा, लीना आलोक के साथ में देखने गए क्या, मूवी। कौन सा, यस नाम से कोई भी मूवी देख लो। सीता, विल्डा, गिफ्टा, सीता, विल्डा, लीना आलोक के साथ में शमशिरा मूवी देखने गए, ठीक है, सिंपल, शमशिरा मूवी देखने गए। सीता, विल्डा, लीना आलोक के साथ में शमशिरा मूवी देखने गए, सिंपल। आप ऐसे ट्रिक्स बनाओ जो आप खुद की याद रहेगी। मेरे ट्रिक्स आपको यूजफुल रह भी सकते हैं, नहीं भी रह सकते। सो मेरा अलग अलग होता है, मैं ट्रिक्स के ऊपर बिलीव नहीं। देन ये हो गए आपके ड्रग्स विच इंक्रीजेस द इंसुलिन सिक्रीशन। These are the drug which increases the insulin secretion. Now, drugs which overcomes the insulin resistance. तो आप मुझे बोलो, these drugs, all these drugs, they secrete the insulin, and that's why they are useful in the which type of diabetes. ये क्या करेंगे, इंसुलिन का सिक्रेशन बढ़ाएंगे। तो इंसुलिन का डेफिशिएंसी किस में होता है, टाइप 1 डायबिटीज। दे आर यूज्ड इन द टाइप 1 as well as type 2 diabetes, okay, but mostly they are used in the type 1 diabetes because there is insulin deficiency. अगर इंसुलिन कम है, डिफिशिएंसी मतलब टोटल एब्सेंट है, तो इसका यूज नहीं होगा। इफ देयर इज अ इंसुलिन, देयर आर द बीटा सेल्स, but they are not able to produce insulin, or they, okay, so there is a less insulin. So in that condition these drugs are helpful। if there is a insulin resistance, अगर इंसुलिन का रेजिस्टेंस है आपको, insulin is there in your body but your cells are not responding to that insulin, so in that condition what happen, drugs which overcomes the insulin resistance, these two drugs which overcomes the insulin resistance. So in that you have two classes. First one is the bigonides, in that metformin, penformin, acetotoxamide and tolzamide. Okay, there are four drugs: metformin, penformin, tolzamide, acetoxamide. Okay, each are drugs. So they are known as the bigonides. Okay, and their mechanism is the AMPK activator. AMPK activator. ये क्या है AMPK? A for adenosine, M for monophosphate, adenosine monophosphate, okay, the P for protein and this K for kinase, adenosine monophosphate protein kinase activator। तो ये क्या है, एक एंजाइम लगता है ना, काइनेज नाम का है ना, तो इसलिए एंजाइम लगता है। सो AMPK एक्टिवेटर। सो व्हाट इज द रोल ऑफ AMPK? AMPK का रोल क्या है? सो एडेनिन मोनोफॉस्फेट प्रोटीन काइनेज का रोल क्या होता है? सिंपल, एडेनिन मोनोफॉस्फेट प्रोटीन काइनेज विल डू टू थिंग्स। कौन से दो टू थिंग्स करेगा? फर्स्ट इट विल डू डिक्रीज द प्रोडक्शन ऑफ ग्लूकोज, डिक्रीज द प्रोडक्शन ऑफ ग्लूकोज, ये ग्लूकोज का प्रोडक्शन कम करेगा। कौन करेगा? AMPK, adenine monophosphate protein kinase। it will decrease the production of glucose, and second thing it will do increase the utilization of glucose, it will increase the utilization of glucose का। so AMPK activation results in the decreased production of glucose and increase the utilization of glucose। now decreased production मतलब क्या है? प्रोडक्शन डिक्रीज होगा मतलब क्या होगा? so gluconeogenesis will be inhibited, gluconeogenesis will be inhibited and glycogenolysis will also be inhibited। so it will decrease the glyconeogenesis and glycogenolysis, glycogen को break down करने नहीं देगा and glucose को नया बनने नहीं देगा। so it will decrease the production of glucose, okay, and it will also increase the utilization of glucose। utilization कैसे increase होगा? so it will increase the glycolysis, it will increase the glycolysis, it will increase the glucose transporters, okay? It will increase the sensitivity of cells to the insulin, that's why drug used to overcome the insulin resistance, right? okay, समझ में आए? बाइगोनाइट्स, यस, बाइगोनाइट समझ में आ गया। it will do two things। first thing क्या करेगा? it will decrease the production of glucose। production of glucose मतलब क्या है? प्रोडक्शन कैसे होता है ग्लूकोज का? टू वेज से। कौन से? फर्स्ट is a glycogenolysis, glycogen का ब्रेकडाउन होगा, so it will inhibit the glycogenolysis। second production कैसे होगा? gluconeogenesis, so it will also inhibit the gluconeogenesis, so it inhibit the production of glucose, right? now second thing is nothing but the it also increases the utilization of glucose, ये glucose का utilization बढ़ाएगा, it will increase the utilization of glucose and will increase the sensitivity of cell to the insulin so that glucose will be oxidized। So AMPK activator, metformin, pyrformin, tolzamide, okay, tolzamide, and then acetoxamide. Okay, all these drugs are known as the bigonides. Then next is nothing but thiazolidine in that thiazolidine diones. So thiazolidine diones means they okay, that is a chemical class. A bicarbonate भी chemical class है. Thiazolidine भी chemical class है. Now it is the mechanism AMPK activator and again PPAR gamma activator. Thiazolidine PPAR gamma activator. So what is the PPAR gamma? ठीक है, इसका फुल फॉर्म देखो एंड इसका रोल इंपॉर्टेंट है. ये फुल फॉर्म मालूम है, रोल मालूम है, तो आपको क्या ड्रग का मैकेनिज्म है वो समझ में आएगा. मैकेनिज्म जब मैं बोलूंगा तो उस टाइम पे आपको already बता होगा मैकेनिज्म. ठीक है, so that's why I am explaining this. So PPAR gamma means what? P for paroxysm, P for proliferator, A for activated, R for receptor, and gamma receptor. Paroxysm, proliferated, proliferator, activated, gamma receptor. They activated. Paroxysm, proliferator, activated, gamma receptor activated. अभी एक्टिवेट कर रहे हैं इसको, तो इसका रोल क्या है? व्हाट इज द रोल ऑफ सो पीपीएआर गामा? सो दिस पीपीएआर गामा इज नथिंग बट द जीन. क्या है? एक जीन है. जीन पीपीएआर पैरोक्सिस्मल प्रोलिफरेटर एक्टिवेटेड रिसेप्टर गामा. दिस इज नथिंग बट द वन जीन. ओके, जीन मतलब क्या? डीएनए में जो जीन होता है वो. okay? वो जीन नहीं जो मूवीज में होता है. सो डीएनए में जो जीन होता है वो paroxysmal proliferator activated gamma. So what will it do? It will increase the expression. Expression किसका मतलब? expression मतलब आपके फेस का expression नहीं. It will increase the expression. Expression means synthesis of protein. So PPAR gamma is the gene responsible for the expression of insulin receptors. The expression of insulin receptor as well as glucose transporters. तो इंसुलिन का रिसेप्टर इंक्रीज कर देगा, ग्लूकोज ट्रांसपोर्टर इंक्रीज कर देगा. ये इसका एक्सप्रेशन होने के बाद में, इसको स्टिमुलेशन होने के बाद में ये क्या करता है? डीएनए में जाके एमआरएनए बनाता है. एमआरएनए में जो प्रोटीन एमआरएनए बनाता है, एमआरएनए में कोडिंग और बाद में एमआरएनए का प्रोटीन बनता है. सो इट विल इंक्रीज द ग्लूकोज ट्रांसपोर्टर, इट विल इंक्रीज द number of insulin receptor. Okay, so thiazolidine dione, they are known as a paroxysmal proliferator gamma activator. So in that you have glitazones. इसमें क्या है? सब पायोग्लिटाजोन, प्रोसीग्लिटाजोन, ट्रोग्लिटाजोन और एक दो ग्लिटाजोन है. ठीक है, सो दिस इज द thiazolidine diones. ये ड्रग समझ में आए. नाउ थर्ड कैटेगरी miscellaneous drugs. So in that you have alpha glucosidase inhibitor. What is alpha glucosidase? It is the enzyme present in the intestine which will break down the oligosaccharides and polysaccharides into monosaccharides so that monosaccharides will be absorbed. तो ये ग्लूकोसाइडेज इनहिबिटर है. इसको इनहिबिट किया तो क्या होगा? एब्सॉर्प्शन ही नहीं होगा शुगर का, राइट? So there will be decrease in the blood glucose level in the diabetic. Okay, so examples of this: acarbose, miglitol, and volgibose. Acarbose क्वेश्चन इसके ऊपर 3 बार आ चुके हैं. acarbose, miglitol, voglibose. Acarbose, miglitol, and voglibose. So these 3 drugs, they are known as a alpha glucosidase inhibitor. So they will inhibit this enzyme, and enzyme will not do its work. What is the work? To absorb the monosaccharide. So to convert the polysaccharide into monosaccharide. So that will be prevented, and increase in the blood sugar level will be prevented. So that's how they will decrease the miglitol, acarbose, and voglibose. Remember, जो बोस होते हैं ना, बोस, BOSC, बोस. ये जितने भी बोस है ना, तो इसकी ही कैटेगरी है बोस इनके है. और यहाँ पे मिग्लिटॉल जैसे और एक ड्रग है, टॉल वाले 2 है. देन नेक्स्ट होता है अमाइलिन एनालॉग. Okay, amylin. So what is amylin? Amylin is again a peptide. Again, it is a peptide. It is known as a islets amyloid insulin protein. Okay, islets amyloid insulin protein. So it will decrease the absorption of sugars from the intestine. So it's analog. इसको support करने वाली drug. That is a pramlintide. Remember, pramlintide is the only drug after the insulin. It is used in the type 1 as well as type 2 diabetes. Then next one is a dopamine receptor agonist. D2 receptor agonist is a bromocriptine. Last class था आपका सोडियम ग्लूकोज कॉन्ट्रापोर्ट or co-transport 2 inhibitor. So that is the responsible for the absorption of glucose, reabsorption of glucose from the proximal convoluted tubule. पीसीटी में जब ग्लोमेरुलर फिल्ट्रेशन होता है तो सब कुछ फिल्टर हो जाता है, शुगर भी होता है, बट रीअब्सॉर्प्शन होता है शुगर का, रीअब्सॉर्प्शन होता है इन द पीसीटी proximal convoluted tubule. That reabsorption is affected by this sodium glucose counterport transport and its inhibitors. इसको इनहिबिट करेंगे तो क्या होगा, ये ग्लूकोज को रीअब्सॉर्ब नहीं होने देगा, मतलब ब्लड में और किडनी से ब्लड में नहीं जाएगा, तो ये कहाँ जाएगा, फिर यूरिन में जाएगा. इनका सिंपल होता है, दे कॉजेज द ग्लूकोज यूरिया, दे कॉजेज द ग्लाइकोज यूरिया. ओके, सिंपल. अगेन द क्लासिफिकेशन. Okay, classification of anti-diabetic drug. I will repeat this in a very simple way. So those drug which increases the insulin secretion. Insulin का secretion बढ़ाएंगे. So in that you have first sulfonyl urease. Sulfonyl urease. Sulfonyl urease, they are nothing but the KTP channel blocker. उनका mechanism क्या होता है? KTP channel blocker, potassium sensitive, ATP sensitive potassium channel blocker. Sulfonyl urease. So in that first generation, tolbutamide and chlorpropamide. See, tolbutamide and chlorpropamide. Then second generation, in that you have glibenclamide, which is also known as a glyburide. Then glipizide and glimepiride. Okay. Then second आता है miglitinides. They are also known as a phenylalanine analog. तो mechanism क्या है इनका same, KTP channel blockers. पहले जो दो है same mechanism. So example is nothing but the nataglinide, rapaglinide. Okay. Third is the glucagon-like peptide agonist, GLP-1 agonist, exenatide and liraglutide. Then fourth class is nothing but the dipeptidyl peptidase 4 inhibitor, DPP4 inhibitor. So all the gliptins, sitagliptin, valdagliptin, saxagliptin, linagliptin. Next होता है those drug which overcomes the insulin resistance. Okay. इसमें आएगा first bigonides. They are known as AMPK activator, adenine monophosphate protein kinase activator. So example is nothing but the metformin, fenformin. ठीक है, metformin, fenformin, then tolzamide, then acetoxamide, चार ड्रग. Then आता है miscellaneous drug. So in that thiazolidine diones. So they are known as a PPAR gamma activator. Peroxisome proliferator activated receptor gamma activator. So pioglitazone, rosiglitazone. Then alpha glucosidase inhibitor. So all the Bose and Toll. Okay, acarabose, militol, volgibus. Okay. Then amylin analog pramlintide. D2 receptor agonist, bromocriptine. Last में आता है sodium glucose contraport inhibitor, dapagliflozin and canagliflozin. Classifications